This is a video for sulfonamides, and the prototype for sulfonamides is TMP SMZ, and the first one is T for UTI, and they can treat UTIs because they have an increased concentration in kidneys, so it's able to make it all the way to urinary tract. Make it to the urinary tract. So there's your other T. Sorry, there's an arrow. Make it to the urinary tract. Second one is an M, which stands for another thing it treats, which is MRSA. And every time I hear the word MRSA, I want to make the ER sound, MRSA. So you can also remember that it treats E. coli as well. And the other E is ear infections. The next one is P, which is pregnancy. You should not give this. Can't spell. Pregnancy, you should not give this in the 3rd trimester, and that goes along with the S, which is small babies. So any babies that are less than 2, not 20, 2 months old should not get this, and that is because it increases bilirubin in the blood, which can then lead to jaundice. So the next one is M, and M's, when you write them fast or when you write this word fast, it can look like an R and then an N. So that is because it can also treat, be used to treat burns, and it can be given topically and prophylactically. And then the last one, Z, is you have 2 arrows and 1 arrow going down. Our 2 side arrows are actually going to be up, and these are for our drug interactions. So our first up arrow is for increased anticoagulants with warfarin. Increase anticoagulant with warfarin, which can then lead to hemorrhage. The second up arrow, or 2 side ones are both up ones, is for increased hypoglycemic effect with oral hypoglycemic meds, which is an issue for somebody with diabetes. And our last one is our down arrow, and this is because it will decrease the effects of birth control. And that is sulfonamides, which treat UTI, ear infections, respiratory infections, MRSA, and E. coli. Don't give it in 3rd trimester of pregnancy or small babies less than 2 months old. Can also be used to treat burns, and can be topical and prophylactic. And with all antibiotics, it can also have a reaction with a rash and photosensitivity, and that is for sulfonamides.